All right, good evening. As you know, we are having our Zoom session this evening on fitness and stretching and essential stretches that you should be doing every day or that you can do every day. My name is Leah Johnson. I'm from the Bahamas Anti-Doping Commission. Today I have here with me Dr. Elviann Pinder and Cordero Bonamy, physiotherapist. So first I'm going to introduce Dr. Elviann Pinder. Dr. Pinder is a physiotherapist and she's the owner of Your Neighborhood Physio, the leader in home care services. Dr. Pinder has been practicing in Nassau, Bahamas for 7 years, almost a decade of service for her country. She received her degree from the University of Montana, and she specializes in home visits for general rehab cases, sports medicine, and geriatrics. Give it up for Dr. We also have Mr. Cordero J. Bonamy, better known as Mully. Mully is the owner of Active Body Rehab. Having completed his secondary education at St. John's College, the Great Giants, not the Giants in the lobby, in Nassau, Bahamas, Cordero then went to attend Dickinson State University, where he received his BSc in biology in 2011. He continued on his studies at UWI Mona, where he received his BSc in physiotherapy in 2016. He returned home at the end of 2016 and devoted his time volunteering in sports, at events, and raising awareness of physiotherapy in the Bahamas. He founded Active Body in August 2017 and has gained experience by traveling with numerous Bahamian national sports teams. His desire is to assist others. Combined with his extensive knowledge, it fuels him to help patients regain functionality. Let's give it up for Mr. Bonamy. All right, so today I'm going to be the stretcher. Yes. All right, I'm the stretcher or the stretchy. No, you're the stretcher. So bear with me. You're going to be doing most of the work. All right, guys. So we are going to start off with just saying what stretching is. So stretching is taking a muscle or a joint past the range of motion, basically stretching those muscle fibers. Sometimes they get bunched together and it causes a lot of pain and discomfort. And it happens to everybody. Once you're a human being, once you're moving, that's going to happen to you. So somebody out there created stretching to help make it better. So we're going to show you a lot of stretches that you could do throughout the day to help you out. All right, so tell them about yourself. What do you do? Okay, I am an office administrator at the Bahamas Anti-Doping Commission, where we test athletes. It's doping control is what we call it. We test athletes, blood tests, urine tests, to make sure that there's clean sports going on in the Bahamas. Now, I am a mother too, and I have had 2 C-sections, okay? And I carry a lot of stress and tension in my shoulders and my neck and my back. I literally always have pain in my neck. Somebody sleeping in their leg on my neck, somebody arm on my face. So today, Dr. Pinder is going to show me some essential stretches to help me to keep my body loose, because it's getting a little up there in age. And we want to always stay supple, to be flexible on this road.
And just before we begin, I just want to interject. We want this to be very, very functional. We want this to be very interactive. So after the segment is done, we want to hear from you, the viewers, how you guys go throughout your days, how often do you stretch, is stretching a part of your everyday routine, things like that. So it'll be a very, very short segment because now we want you, the listeners, to tell us about yourselves, what you do on an everyday basis.
All right, so let's get started. So you hold a lot of tension in your upper neck and shoulders, which is where a lot of people do have those tension points. So my first stretch for you is going to be just looking straight up. And usually when we hold a stretch, we want to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And now you're going to bring your chin to your chest. Let's hold that there. 1, 2, 3, 4, 5, 6,
7, 8, 9, 10. Good. So those are 2 basic neck stretches you could start to do. These other ones are for your upper traps. So what you're gonna do is take one hand and put it behind your back. Yes. The other hand is going on the opposite side of your head. Okay. Okay. And so now you're gonna pull in that direction. Good. And you're gonna hold that. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. And I always use the number 10 because it's easy and you could always do something quick. So next side. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. You feeling that, right? So that's my actual most favorite stretch because I sit down and I play a lot of video games and I get tension right up here. All right, so that is your upper trap stretch. So now we're gonna work on those arms and shoulders. Pretty much a neglected part of the body, but you need to stretch. We're gonna bring it across. That hand's gonna pull, and you're pulling not too much into pain, but too much that you feel a little bit pressure. Yeah, if you feel pain, take it back some. All right, good. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Next side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. All right. Next, we're gonna I usually call this the bra strap stretch. So usually as ladies, we need to get behind here. And that's a stretch in itself. But if you could bring it back some more, that's a better stretch. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good.
What am I supposed to feel like down in my back and over my arm?
You can feel it in the arm, but depending on what area is more restricted in the back, you can still feel it. All right, next side. Good. Pull back. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. I usually go next, giving yourself a big hug. A big hug. Now you'll start to feel it in the upper back. All right, so 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then you could go back, straight back. Good. So now you're squeezing shoulder blades together. 5, 4, 3, 2, 1. Good. So you're feeling that. Yeah. So usually for people who type a lot, those are my go-to stretches for them upper body. All right.
After that, I hope you all out there stretching.
Please.
I don't need,
All right.
All right, now you focus on the upper body a whole lot. Now, what would a person do for the lower body? So let's say that Lael is a weekend warrior. She goes to the gym on a daily basis or maybe 3-4 days of the week. She does not know stretches for her lower extremities, hips down. So I'm gonna ask Lael, if you want to get all muscles warmed up before gym, you focus on what's called like stretch, getting muscles primed and ready to do the activities that we want to engage in. So I'm going to ask you to put 2 hands behind her thigh right here from the side. She's going to do what is called an active hamstring release. She's going to take this up, take this down. Do that for me 10 times, please. 1, 2, 3, 4, 5. How are we doing? 6. Good. 7, 8, 9, and 10. You want to even this off because you want to do this on the next side. I'm going to put this leg right down here on the bed. Please do it on the next leg. 10 reps here. 1, 2. Is it? 3. Okay. 4, 5, 6, 7, 8, 9, 10.
Okay, I have a question. Am I supposed to point my toe or just keep my foot pressed?
Actually, I was going to get into that right now.
Okay.
Start with show. So Lael is warming her legs to get ready for the activity she's going to engage in the lower body. Whether it be squats, lunges, jump, skips, all of that. She wants to warm down, which is very, very crucial after the activity because it increases the amount of soreness that first feel. So I'm going to ask Leah to take the stretch strap right here. She's warming down after the gym now. A lot of people tend to forget this. She wants to hold the same static stretch. Ellie gave us a count of 10, so I will follow suit. I'm actually hold the stretch for 10 seconds. I'm pointing towards down. How's that? Ready to feel the stretch? A mild discomfort, right?
Yeah.
Awesome.
We're
We're going to hold it for 10 seconds. I'm going to count down for you. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And we're going to count down. We're going to switch over to the next leg. And the same stretch here applies. It was like all the way up into the air. And how's your breathing with this? Good.
So I have to breathe in into my nose, out my mouth.
Just relax, breathing. Holding your breath here. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm going to put this leg down. A set of muscles that a lot of people tend to neglect while working out or going through normal daily activities are the thigh muscles, those groin muscles. Do your thigh feel tight? Just sitting all day at the desk.
No, not really. It's more like I feel more tension in my back on my neck.
Okay, so we're going to show you the back stretch now. If you want to stretch your lower back out, let's say you've done some squats or you've been sitting at a desk maybe 7 hours a day, you want to stretch the lower back out. When in pain, a simple stretch where you want to bend both knees and put them all the way to the chest. This is a knee to chest stretch. And pull it all the way forward. You're going to count down from 10, 9, 8, breathing, 6, 5, 4, 3, 2, 1. Kick out for me. Thank you so much. Pull right back in. Same stretch again applies. And pull. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. We're going to kick out one more time. So let's say Leah feels that her stretches aren't advanced, and she's not getting deep enough. She wants help from a local physical therapist. Myself, Ellie, or any of the physios in the Bahamas, we want to assist her with her stretches. So now we're going to come up and assist her. I'm going to do her hamstring stretch for her. I'm going to know. I'm going to count that again. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Coming down again. I'm going to cross over to the next side. And we're coming down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So we completed our hamstring stretch. We even targeted your calf muscles and we completed stretching the calves. Okay, so what we do in the back, we're going to go in front. We're going to actually look better for me. We're going to stand right on the side of the bed. Swim right on. We want to face that down. So we're going to actually step down here. So she's stretching hamstrings. She's stretching calf muscles. Now we're going to conduct the stretch of the quads. All right. You can do your own self-educated stretch here. All the flamingos in high school we used to do a beat.
I never called.
Really? You're not from St. John's. That's okay. So you just put, you grab a hold of your foot and you pull it back. You want to stretch the squat out. Now go ahead and count down for me right here.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good job. Release slowly. Bring it right down to the floor. We're going to do the next leg right here. I'm going to count down for you. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release slowly coming down. Okay. How do you feel now?
Feel stretched.
A little bit loose, a little bit lighter.
See, okay, I have a question. So I've been working out a little, right? So I noticed I was kind of like, I didn't have as much tension, and then I was working out and it was like really really tight.
Right.
Doing regular stretching. So what does that mean? Are my muscles expanding? Are they growing?
So when we work out, our muscles tend to shorten.
Okay.
They don't shorten state. Our goal, because we've been putting so much pressure stress on these muscles, our goal is to come back and counteract the effect.
Okay.
All right. So similar to me, anything you do. I mean, I'm a physical therapist, but I don't always follow. I don't really follow the things that I'm telling patients. So I'm guilty as well. And nobody's perfect in this world. We don't have time to stretch, so we need to make it a part of our life. So that's what I tell the patients as well. know, I want you to do this specific full exercise program. I'm not gonna force it on you, but I want you to make it part of your lifestyle, because we want to do a person's quality. Very important, very ideal.
I want to get
Exactly.
more and more
Flexibility
from
is key, right? Actually, one of our lecture schools at school, first, I didn't understand what that meant, but as we went through our program, we figured out that flexibility helps increase someone, so I would give myself as a prime example. I transitioned back into working out a couple months ago. Wasn't working out for a long time. Squatting really, really heavy. And then maybe over a 3-week period, I was having spasms in my back. But this is because my back muscles are now in a shortened state, right? But I was rushing over the gym going to start work. Exactly. So now I'm going, having a lot of spasms, waking up out of my sleep because my back is walking up the cramping. I said to myself, I'm a physical therapist, I should know better. So I got my business partner gym, and I'm stretching and feel the So now we see why stretching is so important, you know, it reduces the amount of injury. And so this is the approach too.
Think of something in a shortened state, when you go to exercise, think about a squat. Now, when you get down, you're still elongating, right? But if it's short and it's pulling, it could snap. And that's where we get tears and micro tears in the muscles in the joint. And that's how you get injuries. So what we just want you guys to take from it is that you could stretch at all times. You don't have to be an athlete. The fact that you're a human being means that your muscles elongate or they straighten out and they contract or get shorter every day. Getting something from the shelf, picking something off the floor. So even with he spoke about sports, I'm doing more general rehab. I have that person that I bend down to pick up my cat and I just feel something, but you're not stretching the back. So if it's in a short state all the time, you're sitting down watching TV, when you go to elongate now, you know?
Right.
So we gotta keep moving, gotta keep it, that's WD-40. Just like it.
That's just a good way to prevent injuries.
Definitely.
So I have a question about full stretching. So I know I could do these, you know, the ones you showed me for my neck, but the ones with your leg, should you do a little warming up first, or does it matter if you just take a little stretch, you know, if you hold it stretch long if you don't want it?
That's technology, you didn't want to do anything.
Yeah, like I mean, like if I just stand up at my office and I say, okay, let me just touch my toes for a minute, or let me stretch my back out.
No, she's going to reach the area over time.
So if you stretch, it'll warm up.
Right. So stretching has a great deal of properties. Yeah, you can warm the muscles, let them out flowing to those regions. So you actually get to remove toxins out of that. Right? That can actually help with your posture as well.
Also, but we also use physiotherapy, use a lot of heat. So heat, if you're at the office and you have an electrical heating pad, so you talked about your neck, just having a chill out on your neck and it warms the muscles up, gets the blood flowing. Similar like an iron board, gets those wrinkles out, so when you go to pull now, you're able to get down. All right.
So even too, I see we have office, we have some people who came in who are like someone in particular who's an office worker. So our office workers, especially with that sedentary lifestyle, sitting at that desk for anywhere between 7 to 8 hours, it's very, very crucial for them because now we get to prevent a whole lot of back injuries.
All right, so we can check some questions now.
We can actually hear from our athletes. Want to hear some of their
Yeah,
stories?
guys, we want to hear from you. Is there any particular question we could answer about stretching?
You don't have any. Don't be afraid to hop on the screen and ask us questions. You can unmute your mic and ask the questions that you want.
Yep, Tiana. Okay, Tiana, I need you to unmute your mic for me. I have a question for Tiana. Tiana,
Hey,
how are you?
I'm good.
I need you to tell us in the audience about how your stretches have been, because I know you've been working out. You talked about a workout in our segment just now. Please enlighten us. Please tell the audience.
My stretches have been going good. It's something that I try to make sure I do every day. I know it's been a bit challenging and creating time, but try to stretch at least in the morning and night, especially with my back injury.
And that
So with
one thing.
sitting down to the desk all day and also with the back injury, I agree with the heating pad as well as also doing the stretches.
So you just touched on a vital role there. So we have 24 hours in a day, right? Our day is pretty busy. So I would always say that the person should find the ideal time. You know, you make it a part of you, you make it a part of your lifestyle. I think you just had a question.
No question of my life. Sorry, we have two live feeds going at the same time, so I'm gonna get everyone's questions in. All right, so someone has this Darius, hey Darius. Darius is asking for a stretch for the tensor fascial line, TFM. So groin area, yeah. Okay. All right, so watch out, Darius. We're going to show you now about tensor fascial lata. So that's a muscle in, yeah, in the lower extremity. That's still Mali. Yeah. So check it out, groin injury stretch. But that's yeah. So what he's doing, we call this clown shell. And what you're doing is opening the clown shell as wide as you can. Okay? If you have someone to assist you, they will put their hands here. So if I was stretching this person, this guy, I would push down a bit, okay, to try and get him not too much into a pain threshold, but a mild discomfort and elongation or stretch. And what you do is go back. You can also do this. Go down, right? So put your hands over here. And push down, right? So that's a good groin stretch there. Of course, foam rolling is going to be great to do post workout or even before. All right. I don't. Yeah. Go down. You got it. I think it was about talking about stretching post strength training.
Stretching, yes.
Yeah. So
What are the benefits of TC?
we talked about
What are the benefits?
sports doctor extraordinaire. Yes, post strength training. I see the benefit in it. I like it personally. When I work out, I like to stretch after my workout. So here's my workout when I do strength training. I do a quick warm up, whether that be a dynamic stretch. So my dynamic stretch could be a warm up by itself. I don't have to go on the treadmill and I'm killing two birds with one stone. I'm getting movement in while I'm also stretching, right? Then I would go into my strength training for the day, whether it's legs, whether it's arms. And then I would warm down or cool down. That would be on the treadmill or anything like that. Stair climber if you're doing leg day. And then I do stretch afterwards. So if I'm doing leg day, right away I know I'm gonna have some pain, some soreness in my hamstrings. I just get it out of the way after I finish working out because my muscles are already warm. I don't want them to cool down without me stretching. So I believe there's benefits in stretching post strength training.
Just going back to my slight injury that I have with my lower back, especially from squatting, how those muscles have went into a shortened state. I mean, I literally started doing stretching and they just keep under. So I see it as a huge benefit. Stretching, stretching post strength training.
That was a really good question.
So I have had sciatic issues. And I have a lot of friends that have sciatic issues and post baby, it does not go away right away. So in fact, I went walking Tuesday and the joint, like I would feel the sharp pain on my right side for almost every time. But usually sometimes when I go running, even if it's on the sand, even if I go walking, I'll have like this almost like a jam, like a feeling like it's jammed, like in my hip, right here in the joint. And like it'll go away, but it'll just take time to kind of just mellow out. So I went walking on Tuesday and it just kind of went away today. So for person suffering from that sharp sciatic pain, oh my goodness.
Alright, so let's get into education of what the sciatic nerve is first, once we could let everybody know what we're talking about. So the sciatic nerve runs from the spine and it basically gives life to our legs. That's the leg that's important for movement. Okay, and it's a big, thick nerve, and depending on where it's coming out into the body, it could get trapped, and that irritation causes pain. Okay, so yeah. So let's show you some quick sciatic nerve stretches for you.
Taking this leg up. So now you take your hand, put the right behind the side, right? Your own self-sustained stretch. Now you want to put pressure on that nerve. And hold. Make sure you're breathing. Hold your breath.
Because I was holding my breath.
Breathing. 10 seconds. 7, 8, 9, 10. Releasing slowly. I want you to do the same on the next side. Like even on. Good. Come on, right behind. And hold. Breathing again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you've done this on the bed. Let's say you're at work and you feel a flare or a trigger or anything of that sort. So you're sitting at your work desk. You can actually do this and sit. Sit right in the chair. So I want you guys, especially my desk job workers. So now she's at work, she's sitting at a computer, she's had a flare of sciatica. You can simply cross this leg over right onto the left thigh. Placing 2 hands right here in front of that leg, I want you to lean forward. Still feel the same stretch. So you can actually do this at work.
Okay.
All right. Same 10 seconds. Make sure you're breathing. Count it out for me.
10, 9, 7, 6, 5, 4, 3.
And you have to even it all. Right, even here.
And do you go deeper into this work, or do you feel it with you, or do you just kind of stick?
So the cool part about stretching is you may find that today is Thursday, I'm only getting this far. If you check it again on Tuesday, you could start to push it so far. Yeah. So we don't want you to build Rome in one day.
Okay.
I don't expect you to touch the floor, but eventually, as you get flexible, and some people are just born flexible like that. We ain't not blessed. So once over time, but you keep working at it, that's the
Darius Johnson. You can unmute your mic, Darius.
That's what you want to do.
Everybody's so quiet.
We do have another question from.
You can unmute your mic,
Hey.
Darius.
Oh yeah, good evening, everybody.
Darius, you in the gym?
Yeah, so
Everybody's so quiet.
oh you okay there, mate?
Yeah, we can hear you.
Hold on one second.
Hey, Darius, you at the gym?
Oh, oh, in this picture.
Yeah, we can hear you.
Oh,
Okay.
sorry, my bad. I had to switch. Because I was looking at you from 2 ways. Yeah. So my question is, right? First of all, thank you guys for doing this. This, my goodness, like when you get deep into fitness and you try to do a lot, well, your body will start playing the thought. So my question for you guys is, right? So can anyone just like do we need a referral from a doctor to see you guys?
So that is a perfectly good question. And legally, the answer is yes. In the Bahamas, we're not able to bill insurance, especially on our own, without a referral from a physician. So the legal answer to that question is yes. However, for other services such as like a massage, if you would come into a physical therapist's office for a massage or a technique like cupping or
Just
stretching,
stretching.
yeah, it wouldn't require a doctor.
Oh, okay, because I always wondered. Now, my next question is now, like, what do you take, or what's your take on yoga? Like, is it something that should be mixed, or is it
Yoga.
just cool to just do static stretching? Like,
Well, I love yoga because most of the stretches we may give you in physical therapy have a yoga background. I'm not really sure who came first, yoga or physio, but it's almost the same. So for you, if you're someone who does strength training a lot, I would say yes, yoga is a good way to switch up your workouts or to like do it probably once or twice a week because you get that full body stretching in.
yeah. Well, like, I'll be honest with you, I tried yoga before, that was like torture, so I'm like,
This guy, he lifted, I think he lifted squat or deadlift, something yesterday, and I was like, man, like that was a lot of weight he was pushing. So
yeah. Yeah, moderately fine. Yeah, I'm trying, but
Get your stretches in.
man, and that's my thing.
physio came first. Physio came before yoga, so I'm gonna go with her. I agree.
Yeah, because right now I can say personally,
Massage guns.
I feel it now. Oh yeah, and then that question too, massage
Yeah.
guns.
So I like massage guns. I like foam rollers because they help in self-management. What that means is once you're regularly massaging your own legs, upper back, you wouldn't develop such tight muscles that would cause an injury. So for me, massage guns and foam rolling does a great job in decreasing injury. Now you have to do it on a consistent basis, of course. So I usually tell people after workout when you're still warm. So you still have the warm muscle effect, so that could break up muscle fibers and not cause too much pain. Or you could do it before.
All right. So pre-stretching, that's kind of effective to that.
Definitely.
All right.
I can't lie, for pre-stretching too, I sometimes use the gun as well.
Mhm.
You know, like I definitely use the gun to warm the muscles up. If I really, you know, if I don't have enough time, I really use the gun, get the muscle, get the blood flowing in the muscle, then just jump right into the workout.
Okay, all right. Then move on to that.
All right, next hand raised, Robert Johnson.
Hi, good evening, everyone.
Good evening.
I have a question. Let's say I have a home gym and I don't have a lot of space and I also don't have a lot of time. What stretches could I do specifically? Because you could always run in place and stretch for your legs and your lower body. But let's say I want to do bench press today and I plan on lifting anywhere upwards of 200 pounds. How do I stretch my chest and shoulders so I don't tear a muscle adequately without having enough space? Or it may be raining outside, or I just don't have a big yard or whatever. How do I stretch properly for that?
So before your workout, you meaning?
Yeah, just to get warm. Because all right, let's say I have work for 10 o'clock. I get up. I only can get up at 8, and I only have like an hour to really get a workout in. I don't have enough space to run up and down and stretch out. I just need to get a quick workout in, but I want to push some serious weight.
Right. I would definitely encourage and recommend that you do dynamic warm-ups when you're about to get into your workout. So arm swings, arm circles, things of that nature that can help a whole lot to get blood flowing into the area. Well, Ellie's showing an example right now. To get blood flow in the area, if you're going to be pushing and bench pressing and shoulder pressing, you need that blood flow, you need that oxygen coming into those muscles, because that's a lot of weight. So you're going to be, you need to sustain.
I could also give some advice. I find it very helpful to lift the bar with no weight on it and just go through what we call the range of motion or the motion. So let's say you are doing a bench press, lay down on your bench and just go with no weight and go the full stretch of the arm and then come down all the way so that you're getting that stretch. And that way you're still doing what you came to do, but you're going the full range that your body can allow.
Okay, thank you.
You're welcome.
We have a question from Raquel Corwell to everyone. Hi guys, any specific sleeping positions that aid in avoiding stiff necks and backs.
All right, that's a common question. So we can bring the table back, bring the bed back. So we can use you as an example then. All right, so sleeping position. Let's go with back first. All right, so if you can see her legs now are down, she's starting to sleep on her back. Now, what happens most time is we lose the curve, the natural curve in the back, and it starts to get very flat. So what we use are pillows to help bring the curve to your back. So if you're laying flat on your back, usually you would put your pillows underneath your legs. Good. And then that should start to even out. All right. If you're a side sleeper, so turn people down. Side sleeper, bend both knees. So you want to bend both knees, and your pillow could go right here. Okay. So now we're bringing the curve in the back. Okay. Now, if you want to sleep on your tummy, so normally we do this, and we start to sink too further down into the bed, and that's where we get all that pain from here. And so now our pillow goes underneath the pelvis. Right. And then we start to even out. All right. In terms of neck pain, some people like the specific pillows for the neck, for cervical pillows that could give you a nice
Curve.
Yeah.
I think, and those actually can be purchased off of Amazon. I actually just recently bought one. And they're not too expensive as well, ranging from anywhere between $29 and $40.
There you go.
So it helps a whole lot.
Good question.
You have a question from Kermit Taylor?
Okay, go ahead, Mr. Taylor.
Hey, good evening, guys. How you guys doing?
Pretty good. How are you?
Good, good. Thank you so much for the lecture this evening. Question though, and I'm only asking that because I hear a lot of people talking about gym and lifting weights and stuff, and I'm an old gym nut from back in the day. I'm going to be 60 in September next month. So my question is this: I know some of the little issues I'm experiencing now is from some of the bad habits I had when I was competing. A lot of times I come to the gym, if I arrive late and I was full into the routine, I would kind of shortcut the warm-up routine to jump into and then jump right into the workout session with the guys. And I know some of the little skeleton issues I'm experiencing right now, I know it's from bad habits. So talk a little bit about some preventive measures we should take as opposed to, because we take it because we're young, we take it for granted. And I can say now, as I've gotten older, I'm kind of beating myself up for shortcutting some of the warm-up routines I would normally go through just so I could get caught up in the workout routine.
Okay, good question.
So it goes back, I don't know if you just joined, but it goes back to, I had an experience similar to you, so I could definitely relate. Like a couple of weeks ago, I was experiencing terrible back spasms, and that's all because I was cutting the workout short, which I shouldn't have been doing. I should have known better, but like you said, you press for time, your day is shortened now because you got to get in the gym, get a workout in, and get to work, right? So let's say your workout is for an hour, and 45 minutes of that is indeed devoted to your workout, your routine. So I would say that next 15 minutes, you could actually split that in half. If you want to warm up for about 7 minutes, go into your routine, and then maybe post exercise, take that last 7 minutes, and then you just do your static stretching. So you actually have a lot of things, you have variables to play around with, especially with time. But you definitely don't want to neglect the warming up and warming down phase.
Okay, C Pinder. C Pinder. Oh, this is the other question. Okay,
So we have a question. Are exercises help with excess fat in the back? So the technical answer for that is you can spot train fat. So what happens is let's use the stomach, for example, or we could use the arm. Sometimes we say, okay, let's do some crunches so I can get rid of this excess fat. But the body doesn't work like that. The body, if we were able to do that, everyone would have a six-pack, right? So the way to get rid of excess fat, the only way is to have a calorie deficit, meaning that you're eating less than you consume in energy. So basically, energy is how we make energy by eating food. But if you eat food and don't burn off your energy, then it's gonna sit in the form of fat. So you're gonna go into a calorie deficit, meaning you're eating less calories than you burn. If that makes sense. So the technical answer to that is, it may help a little, but the best way to do it is through diet and regular exercise.
And the other question is, how about sleeping on the shoulder and experiencing shoulder pain? Are there any methods to reduce the pain? Yes, I guess he means his left, because he can only sleep on one side, so in that case.
Yeah, the next thing you would do for sleeping on your shoulder may have to be a pillow in between or a pillow underneath.
Under the arm.
Yeah, or what works for me? Yeah, you can sleep like with the pillow, with the shoulder cradle in the pillow.
So this, I would lay here,
Put the pillow
here,
Yeah. So that way you have a bit of cushion underneath, and you could also, a lot of support, or you can put the pillow underneath the shoulders. Okay. So it's whatever's comfortable for you. And then laying on that side for a while.
you can't lay on that side, or maybe the other spot, maybe.
And I would recommend having an access too.
Yeah.
No,
Definitely have a physio in your Darius,
How
need a
to- how to
physio
assess.
in your back pocket. All these problems can be, all of these problems do not have to plague you. Okay? Get a physio in your back pocket. Just how you have a family doctor, a family lawyer, you need a family physio. Listen, you need it because we work every day. And you're not gonna get as much information on these live sessions as you can. So, and everybody is different. So what may work for that guy may not work for you. So get yourself a physio, man. Let's go. 2021.
So guys, that is our hour. We would love to tell you guys that we greatly appreciate you for coming. We want to say a big thank you to Dr. Elviann Pinder. We want to say thank you to Cordero Bonamy of Active Body Rehab. We want to say thank you to Jenna Gibson of Fitness Motion Therapy. They allowed us to use their lovely establishment. Come check them out. Bottom of the Hill, Collins Avenue.
Waters.
Waters number 15. Dr. Elviann Pinder is a concierge physiotherapist.
I mean, they come to you.
She will meet you wherever you are at. So just let us know. Oh, we have another question? Let's see, we can take one more question. We have a few.
I wanted to hear from all the physios out there.
Oh, great.
Well, thank you for the Bahamas Anti-Doping Commission. We do intend to have another session just like this coming next month. We may have the same people and maybe a few more guests. So stay tuned for what we have next. And don't forget to hit up well, you have a news that, you have someone to hit up now when you need to get that stretching on, and you need your assessments, when you need to learn how it is, how to maintain flexibility and staying loose and taking care of your body as you work out and try to stay fit. Now you have doctors and persons that can help you and be there for you and support you and get you through.
And thank you to the BAPT who actually put the word there and should get the word for this whole segment to go on.
Yes, thank you everyone for
Thank
sharing.
you.
We greatly appreciate it. It was fun. I got a lot of stretching to do.
See you guys next month.
Bye.
Good night, be safe.